You're probably wanting to know when you can start thinking about toilet training your toddler. And I'd like to suggest, first of all, that we don't really think about it as toilet training, but rather about toilet mastery. Because your toddler is at a developmental stage where increasingly he or she is beginning to develop a sense of self, a sense of an assertive self, capacity to say this is me, this is mine, and of course no. So it's not really about trying to train your toddler, it's about trying to help your toddler to do something that they're developmentally geared to do anyway, and to do that with a sense of mastery. It's not something that you can determine, and it's not something that you can predict, although most experts will agree that toileting starts to happen in the second half of the second year, and your task as a parent is really to be aware and to help your child to be aware of when he or she is ready. When we talk about toileting, we are obviously talking about a child being dry during the day and a child being able to use a toilet or a potty for pooing, and then also being dry at night. And those three things don't necessarily happen simultaneously. Boys are often dry during the day, earlier than girls, particularly if they are allowed to urinate in the garden or in the flower beds. And girls and boys are often much later at being dry at night, and I don't think that you should be worrying about that. There's often a genetic component to nocturnal enuresis, and it needs to follow its own timeline. It seems to me today that while there may have been at one stage a pressure to help your child to master toileting very early, there's now an inclination to leave it sometimes a little bit too long, and I think that has a lot to do with disposable nappies. That makes it much easier for mums today to handle the whole nappy business than in the old days where you had to soak and wash a toweling nappy. So the important thing is, even though a parent is not incentivized or as encouraged perhaps to get a baby out of nappies, except that they would save an enormous amount of money every month if you can, I think it does make it harder perhaps for parents to help their children to recognize when they themselves are becoming aware of the urges and the actions of pooing and weeing, which is really what we want to try and help a child to do, to start making the link between what's happening in their body and what's happening in their mind. Another important thing that I think we can do to help our child with toileting is to normalize the use of the toilet, even toilets outside of home. Lots of you may have anxieties about using a toilet in a shopping mall or a public space, but it's not going to be helpful for your child who's just managed sphincter control if you try and encourage him to wait until you get home because you don't think you can manage the public toilet at the shopping mall. And then it's about introducing and making alternatives available and easily accessible. Potties are not as popular as they used to be, and I think that is because there are all kinds of other options, including little steps that help a child to get onto a toilet, smaller seats that help to make the toilet feel smaller. But I think that there is something that we are depriving our children of by not at least allowing them the opportunity to use a potty. A potty is portable. It can be carried around the house so that a child doesn't only have to go to the bathroom to toilet. It can be taken to granny's house and it can be taken on a play date. It can be used to practice with because the toddler can get on and off the potty easily, him or herself, and it can also be used to practice with by putting your teddy or a dolly on the potty. I think it's always useful to think about the relative size of things from the perspective of a baby or a toddler. We're about 3 times the size of a toddler, which from our perspective would be rather like standing next to a tree, a 5-meter tree, which can appear so big and powerful. So if you imagine similarly what it must feel like for a toddler to sit on a big cold toilet with a big hole and a big loud flushing noise, it can be very frightening. It's always helpful, even if you aren't going to use a potty, to give your child something to rest their feet on. But I think what's particularly helpful about the potty is that there's a natural push against the ground, which helps a child to learn something about pushing. For your toddler, a stool is a precious gift, and particularly that first poo that he manages to produce on his own is something that he knows is going to make you proud and make you feel very pleased with him. And it's much easier for your toddler to really enjoy and use that positive experience to build on in terms of increased toilet mastery if the poo is in a potty rather than in a toilet and too hastily flushed away. For some children, there's quite a lot of anxiety about making a poo out of a nappy because they see it as part of their body, so that it's something that's been sort of cut off or removed, and there can be some anxiety. And again, I think a potty is a safer space for a child to try and negotiate those kinds of early anxieties. A potty is a container, and using one can help a child feel much safer, and I think it's a good step on the way to managing the big toilet. In my consulting room, I often get asked by parents what to do if toileting doesn't seem to be happening in the way that they have been led to believe it should be happening. First of all, I want to reassure you that according to most experts, a child may not manage toileting until their 4th, their 5th, or even their 6th year. And that it's only at that point that we really start to be worried that there may need to be some kind of intervention. I know that schools put a lot of pressure on parents to have a child toilet trained by the time they start, usually by the time they're 3. But not all children manage it as easily as others. And it's not a quick thing to fix if it feels like it's gone a bit awry. It's quite a stubborn symptom. I've said before that it's got to do with the developmental phase that the child is at. 3-year-olds are very stubborn. But if this may help you to think a little bit about what may be going on, that has either set up a situation where there has been a regression, a child who was managing toileting, but has somehow either gone backwards and or seems to have gotten stuck. So it may be that you notice that your child is going behind the couch or behind the curtain to make a poo. That's a communication that there's something that's not working out so easily for him, because he clearly knows what he's doing if he's trying to remove himself. But he also knows that he's not doing it in the way that you would really like him to be doing it, which is either on the potty or on the toilet. Sometimes it's going to have to do with the temperament of the child. More headstrong personalities can be much more fiercely assertive and defiant, but a more headstrong personality can also be much more determined and motivated to get this thing right in seeking mom and dad's pleasure and approval. It may be that the child has picked up from one or other of his or her caregivers that there are some difficult feelings about cleaning up mess. Children are sensitive to our facial expressions and our bodily language. And if you or one of the caregivers doesn't really manage feces or doesn't easily cope with any kind of mess, it may well be that the child develops feelings of shame earlier than he or she should really be having to manage them. Small children can respond to these kinds of dynamics by just shutting down and going into a kind of denial, as if there isn't anything happening, and they'll tell you, I'm not doing anything, as a way of trying to avoid it. Research does suggest that families where there are high levels of parental conflict or tension often seem to be the kinds of environments associated with difficulties around toileting. Sometimes difficulties with toileting have to do with change in the family or stress in the family, and one of the most common stressors that can interfere with toileting is the arrival of a new baby. I have some idea that that's often linked to confusions that children have about their own anatomy and babies. We rather unhelpfully talk about things happening in our tummy. Food goes into our tummy, poos come out of our tummy, and babies grow in mum's tummy. So that toddlers can sometimes have a rather washing machine idea of what's going on in their abdominal area. I think it's helpful if you've got a child who's toileting and a pregnancy at the same time, to remind or let your child know that inside our tummies there is a special place called our stomach, which is where our food goes. And there are special pipes that our poos come out of, and there is a special place called a womb or a uterus where a baby grows, and only in a mummy's tummy. Little boys usually know that there is a place that poos come from on their body at the back, and there's a place that we's come from at the front. It's not always so easy for little girls to figure out, and both boys and girls can sometimes be confused about how babies get out of the tummy. I know that many mothers today will have a cesarean section, and so in fact babies do come from a cut on the tummy, but there are children who know that babies come out of a special space on a mom's body, and children can get muddled that poos or pooing may produce a baby. I remember seeing a little boy in my practice who was struggling with toileting at age 5 and who eventually said that he didn't want to poo on the toilet because he was worried that a baby would come out and be flushed away. Too much external pressure on a child's efforts to achieve mastery can have the opposite effect. It's very important to recognize that your child is doing this at his or her own pace. It's helpful if you can make those links between the actions and the sensations of pooing or weeing and efforts to control it. And that's often easily done for boys who sometimes are allowed to urinate in the garden. But many mothers will tell you that they easily helped a child with toileting over a summer holiday by letting the child run around the garden without clothes on. I think what's really important is that we positively reinforce and respond to not only a child's success at toileting, but also their attempts at toileting, and be very careful that we don't berate children when they don't get it right. I think the thing more than anything else that is going to encourage your child to strive for toilet mastery is the pleasure that he sees on your face when he starts to achieve all the developmental steps towards this. That's what's really going to encourage him. And reinforcing both efforts and success is important, and equally it is not going to be helpful if you pay too much attention to the failures and to the mistakes and to the accidents that are invariably going to happen. The bottom line, to use an intended pun, is to support your child in his or her own readiness to achieve toilet mastery, and he will acquire, with a great deal of satisfaction and the pleasure of knowing how much this matters to you, toileting in his own good time.